Hi, my name is Rob Lilly, and I'm the director of Lilly Inspired Training. And we're going to talk today a little bit about shin splints and how to get rid of shin splints. Shin splints are basically an inflammation of the shin muscle, either on the front side of the shin or the back side of the shin. And our deal is that we're trying to get athletes to a point where they don't have pain in the lower leg so they can explode and create power when they're running or jumping or being athletic. This is Annie, and Annie is going to run us through a couple different things we're going to do with this run rolling pin. Ideally, there's different ones you can use out there, but what we're going to start with is we're going to roll Annie's shin muscle by going up and down. You can use a lot of different run rolling pins to do this. I call it a run rolling pin just because there's so many different versions, but Annie is rolling upon her anterior tibialis muscle. We're just trying to move blood flow through the area and basically break up some scar tissue. After we do the shin, Annie's gonna go to the back of her leg into her calf. She's gonna roll all the way down just above the Achilles tendon and then all the way up toward her knee. You can notice that she's going on the inner part and outer part of her calf as she does this. We're just creating an opportunity again to bring blood flow to the area and break up some scar tissue. Very good. So we do the front anterior tibialis and then the calf. And then after that, Annie's gonna go into a figure 4 position with her legs. And she's going to push her fingers between her tibia and her calf. This will be very sensitive to most athletes. But ideally what we're trying to do is break up and or kind of massage the muscle under the calf called the soleus. This one is something you need to do and be really wary of when you're doing it. Annie's just walking her fingers up and down the soleus. Again, behind the tibia bone and in front of the calf, there's a gap area. And we want to make sure that we're creating some intensity that doesn't hurt, but also doesn't feel perfect. So Annie's probably feeling like a 6 out of 7 or so on that muscle underneath. Is that fair?
Yep.
One thing that we'll do sometimes is I'll have Annie hold where she's at there, and then she'll just pull her toes up toward her nose and then push her toes away so that the actual muscle itself is pushing into Annie's fingers instead of Annie pushing into the muscle itself. And she can do that up higher where she just goes toes high and toes low. You can actually see her muscle kind of open and close as she does this toe up and toe down movement. That's going to help us to get the soleus opened up and kind of relax a little bit, which will help with shin splints as well. Normally shin splints is actually a problem that happens because the calf gets so tight that it is not working at its full opportunity. And as a result, the anterior tibialis musculature or the posterior tibialis, the front side of the shin and the back side of the shin, often have to take up the slack for the calf when the calf quits working because it gets tired. So now Annie is on her bottom. She's gonna go roll back and forth across her calf. We call this cross-striation rolling. You'll notice that she's rolling all the way over and all the way back across the whole calf. When she gets over toward us with her toes pointed towards us, that basically is rolling onto that soleus through the calf muscle. And then when she goes on this side, she's rolling all the way to the tendon on the outside of the leg called the peroneal tendon, which if you ever had an ankle issue, that's one of the tendons that tends to tear and or causes a problem at the ankle. So that was perfect. So this is again gonna help shin splints because we need the calf and the muscles around the calf to basically relax and be more mobile. So then the shin doesn't have to do as much work. Good job, Ann. All right, then Annie's gonna do ABCs, which is just a manipulation of the feet. She's gonna draw the ABCs with her feet. We don't have to have her do the entire ABCs, but the idea here is that as she draws the ABCs, she's bringing blood flow through the lower leg and creating an opportunity to get rid of some scar tissue from what we've just done with foam rolling and some lactic acid. Brings in new oxygen to the musculature and so on and so forth. And then the last thing we're gonna do is have Annie, and this is pretty challenging for a lot of people, but Annie's actually foam rolling her shin muscle. So she is in a position where her shin is rolled onto the calf, or excuse me, onto the foam roller, excuse me. And she is in a little bit of a position where her feet are crossed so that she can roll on that. This is quite challenging, and I'm very thankful for Annie to do this because a lot of people have a hard time with this, but ultimately it also hurts a lot. So thanks, Annie. You don't have to keep going if you don't want.